Hello, everyone, and welcome to today's webinar on managing your business through COVID-19. Just a few housekeeping rules up quick is to make sure everyone has muted themselves and that your video sharing is off. We're glad to have you join us today. I'm Dawn Cornelius, the Vice President of Marketing and Communications at the Nashville Area Chamber of Commerce. Thank you for joining us today. We're grateful for all of our partners who have helped put this webinar together. This webinar is co-hosted by the Nashville Area Chamber of Commerce, the Nashville Mayor's Office, Nashville Entrepreneurial Center, Small Business Administration, Maury County Chamber and Economic Alliance, Dixon County Chamber, the Nashville Healthcare Council, Pathway Lending, and Williamson, Inc. In addition, we're grateful for all of our presenters that will be a part of today's webinar. You will hear more from them and more about them as we move throughout our session. And just a note also that our webinar is being recorded and a recorded version will be available after today's session. And a web link will be emailed to you at the conclusion to provide you additional resources. So we would love to hear from you. There will be an opportunity at the conclusion of our session in which you can ask your questions and do that through the chat window. Just as a reminder again for some of our housekeeping notes, be sure to mute your microphone. We're hearing some of you who have not muted your microphone, so just find the mic button and click that. That should be red that indicates that you're muted. And then make sure that also that your video is turned off, and that will also need to be red. In order to find the chat window, it's also on the bar with all the other tools. You'll see a thought bubble, and simply click that thought bubble. And throughout the presentation, if you have questions, simply type those into the chat, and your questions will be answered during our Q&A time. So just stay tuned. We're glad to have you today. And once again, if you have not done so already, please mute yourself, disable your video sharing. And presenters will be unmuted as they speak and they'll share their video. For those of you who are just joining us, welcome to today's webinar. And I'd like to introduce to you Ralph Schultz. He's the President and CEO of the Nashville Area Chamber of Commerce. Ralph.
Can you hear me, Don? Hey, Don, can you hear me?
Yes, you're good to go, Ralph.
Okay, great. Well, everyone, thank you for joining us today. By your presence, you're showing that you are energized and working to meet the challenge that
Hello, Nashville business and business owners. Mayor John Cooper here. This has been a challenging and unprecedented month for our city. The tornado and now COVID-19 are putting enormous strain on everyone. So many of you stepped up in the days after the tornado to focus on your rebuilding and to take care of your employees and provide resources and relief for those affected. Now, as a city, we are fortunate to have you. As entrepreneurs and longtime business owners, you continuously support our community, and now we are here to support you. We're committed to providing critical resources and timely information to help you during this trying time. I believe that we will overcome these challenges and preserve the strength that Nashville has been known for. You can count on us to maintain strong connections with our business and community partners as we navigate this uncharted territory and rebuild together. I'm grateful to our partners who are here to support and answer your questions about business continuity planning, recovery, insurance negotiation, workforce management, and access to capital. The road ahead won't be easy, but my administration and our whole city is standing with you. Be strong and stay healthy, Nashville.
All right, thanks again. This is Stephanie Coleman. I'm the Chief Growth Officer here at the Nashville Chamber, and thank you all for bearing with us as we work through technical challenges with this web platform. This is our second go-round, and we're learning as we go, but really appreciate everyone being on today. We are now going to start into our presentation. We're very excited to welcome Dr. Michael Caldwell, who's the Director of the Metro Nashville Public Health Department. So we'll turn it over to Dr. Caldwell.
Yes, super. Well, thank you. Yes, I'm Dr. Michael Caldwell. I'm the Director of Public Health in Nashville, and I wanted to give you an update of what's happening today in the Nashville-Davidson County. Today, the mayor has just completed his press briefing for the day to the community. He's announced now that we do have a second death reported from COVID-19 in Nashville-Davidson County. We have a total number of cases now of over 300. And we do expect that number to continue to grow. You can get information about the coronavirus outbreak, as well as everything else the health department is doing at health.nashville.gov. We want you to know that there's a hotline that you, your employees, and your community, family and friends can call for any questions. We have public health nurses staffing this from 7 a.m. to 7 p.m. 7 days a week. And that number is 615-862-7777. The mayor and Dr. Jahangir, as the chair of the coronavirus task force, has also just announced that we expect assessment centers to be starting as of Monday. Now, this is to augment our already existing robust healthcare community response. So if you do have your own medical provider, we ask you to contact them first, call them before you go. If you have insurance and you don't have a medical provider, I encourage you to work with your insurance company to find a provider. And then if you still need help, that's where we come in at our hotline to try to help guide people to care. Once again, that's 615-862-7777. I know most of you would be most interested in getting information about the business community, and I'm so pleased that I've worked with the CDC in the past on their business plan. So anything that you may need now with coronavirus or anything else for your business, go to cdc.gov/business. You'll find a whole wealth of information, and you can sign up to be part of the CDC Business Connection. But let's get right to the point of what you're most interested in, which is coronavirus business. How can you plan and respond to this current crisis? Now, there is interim guidance for businesses and employers to plan and respond to this COVID-19 crisis. Right there, you could, the easiest way probably just to Google CDC coronavirus business. And if you Google that, you'll be able to, probably the first thing that will pop up is this interim guidance for businesses and employers. Look at that. There's tremendous information on there, and I encourage you to let me know if I can provide you any assistance or more details with that. For those of you who have companies around the country and around the world, please know there's another way you can help the CDC, and that's with the CDC Foundation. They are great partners that you should know about and help if you can. You can reach them at cdcfoundation.org. But let's talk local. How can you help us locally? And yes, we need your help, and you are helping, and I want to thank all of you who are. The main website that we have is safenashville.org. You can also get to that through the health.nashville.gov or covid19.nashville.gov. So at the safenashville.org, there'll be a button on the left where you can help us with everything from donating personal protective equipment and learning more about the safer at home order and the details, in addition to frequently asked questions. Am I an essential business or not? And I hope that you will find all of this information helpful in one place. We are here for you. I know that you're here for us and the rest of the community. We look forward to getting this virus out of Nashville and Davidson County and out of our country as quickly as possible. So thank you so much. That concludes my remarks, and I'll be happy to take any questions if that. Thank you.
Thank you, Dr. Caldwell. We are going to take questions at the end, and we know that Dr. Caldwell may not be able to stick around with us to the very end. So any questions that are directed to Dr. Caldwell, we will get those to you and follow up afterward. Thanks so much for being with us. We are now going to switch over to Dr. Wright Pinson and Dr. Tom Talbot with Vanderbilt University Medical Center.
Yes, good afternoon. We are going to give you a provider perspective on the situation and also provide you with some information that we think will be useful for the business community at large. As you might imagine, as a health system and a large private employer, we're juggling many of the same issues that are challenging you as we work to keep our operations up and running and also protect the health and safety of our workforce. First, I do want to thank the Nashville Area Chamber of Commerce for organizing this session. I also want to strongly support and applaud the mayor and the Commissioner of Health's efforts. We owe them a big debt for their order to keep people at home as much as possible this past Sunday. That's going to prove to be very important to us. We've seen incredible collaboration across the healthcare industry and our public health organizations in the region during this challenging time. I'm very impressed. I'm very proud of the enormous progress that we have made and the partnerships that have already been forged. I think I speak for everyone on the front lines when we say we do need your help, and we do appreciate your support that comes to all of us and all of the people who work with us on the front lines. I'd like to spend the next few minutes telling you about our perspective as a provider, and then Dr. Talbot's going to give you some advice as an employer about how to manage your workforce. So you may be interested through the hotline that we've set up. We've talked to about 21,000 people who've been concerned about possibly being infected. And there are a number of hotlines to use. Dr. Caldwell just gave you one, and we have a number that we'll put on a slide for you so anybody who's worried, that's a good place to start rather than coming to an emergency room or clogging up the doctor's offices. Just get on the phone and ask questions. The next step is to go to an assessment center. And we have set up about 14 assessment centers. The other health systems in town have also set up a number, and we're going to include a map that shows some of these locations. And I will tell you, in those assessment centers in the past 2 weeks, we've evaluated 13,000 patients. The next piece of interest is testing. And so far, we have tested more than 6,000 patients. The rate of testing is going up. We are backlogged about 4,000 tests at this point in time. There are some national shortages of reagents to do this testing. We are trying to get all of that reagent, just like everybody else who does testing. We have had to send some of our specimens out to LabCorp. Our turnaround time for our in-house testing is about 24 to 48 hours. For the testing that we have to send out, it's more like 7 days. Of those tests that we have accomplished here, we have 390 that have turned positive, and the state overall has reported about 1,000 positive cases, and the positivity rate is running about 6.4%. This is suggesting that many people in our region are already infected, and I think the mayor's order to encourage social distancing is extraordinarily important. That is one of the very best things we can do to reduce the rates that people turn positive. We have admitted about 23 patients to our medical center so far. 6 of them have gone into the ICU. 1 of them has died. We expect the number to rise very significantly over the next 2 weeks. and we expect high numbers of hospitalizations to continue for quite some time. We have equipped our non-clinical teams to work remotely, and we encourage you to encourage your workers that can work from home to do so. We've configured our waiting rooms to create social distancing. And again, we would encourage you for any in-person business to create appropriate social distance. We are curtailing all elective surgeries, and we have ever since the governor gave us the order. Some of the delayed procedures could be detrimental to the patients, and those procedures will continue as planned. We are setting aside as many beds as we possibly can and working out staffing plans to handle as many beds as we possibly can. For all of those patients who cannot come to see their doctors, we are using telehealth, and we have rapidly moved to providing thousands of visits a day by telehealth. And that is going to be very important over these next several weeks to maintain the continuity of care. Supply chain is a big issue. Our supply chain professionals are pulling all the stops to get appropriate equipment. For the duration, though, of this pandemic, since unknown, we do get worried about at some point running out, and we are encouraging very judicious use. We can certainly use donations of personal protective equipment from the community. I want to leave you on a high note, which is our research enterprise continues to function to perform critical life-saving work, and these efforts include creating passive immune serums, which will allow us to treat patients who have the disease. We also are working on antibodies. I think the time frame for those is probably 4 to 6 months for the treatment and probably 18 months for the immunization. I also want to tell you that there's a number of other studies that we are undertaking immediately to begin to determine what is going to be the best way to care for patients, what's the best form of therapy. And I've heard a report on that just yesterday, and it really lifted my spirits that there are several things that are going on that are going to be able to help people who have this disease. So I'm going to stop there and have Tom Talbot give you some key takeaways on how you might consider preparing and responding to COVID in your workplace.
Yep, thanks, Wright, and thanks everyone for joining us. So just a little bit of background, I'm an infectious diseases physician in charge of the infection prevention program at Vanderbilt. And if I see the slides up, can we go back one slide? Whoever's doing, yeah, thank you. So we thought it would be helpful, and I think we've heard a little bit about the CDC's website to kind of guide businesses, but I imagine you're getting a lot of questions about protecting your workplace, your employees, reassuring folks. And so we wanted to kind of give a couple of advisory points, and then obviously during the Q&A can address other questions. So kind of the key things that we would recommend and focus on is really encouraging and educating your employees about how they can reduce their spread. And it's things that you've heard, the messages, but if they have any symptoms, particularly new respiratory symptoms of cough, obviously fever, flu-like illness, they really need to stay home and evaluate for medical care with your provider. Of course, you've heard the message of wash hands, and that's a foundational infection prevention intervention. We know this virus is particularly contagious and it likes to live on surfaces. And so washing our hands, you've heard people say, don't touch your face and nose, because that's probably how we introduce that virus, by touching surface and touching noses and introducing it. Clean the environment, and I'll talk on that a little bit more, but making sure things that are frequently touched are actively cleaned and fairly aggressively cleaned. If you're going to use other employees' phones, desks, otherwise, also make sure that environment's clean. And I think the concept that Wright mentioned of social distancing, we really are thankful for the mayor and for those of you who have been harboring at home, basically. It truly will make an impact and really will help us blunt the surge of ill individuals as we really try to kind of delay this transmission and hopefully reduce it tremendously. It's a new world for many of us, being distant, but things that you can do as are noted on that website, like telehealth or telecommuting and other things, and doing what we're doing now is we're not meeting, but virtually meeting will be very helpful. Number two is really kind of cleaning the environment of the work area. And there's a lot of really good advice on the CDC website about the specifics. So I won't go into that now, but just know that as the CDC advises for workplaces, really the common cleaners that you're using to clean, whether it's diluted bleach, whether it's just regular sanitizers, are effective. And I can provide links to, if you do have a question of things that you use, that whether they're active and active to kill surfaces. We do know some information about how long this virus lives on surfaces. So depending on the surface, it can live up to 72 hours, like on plastic or steel surfaces, up to 24 hours on cardboard, and maybe less so on things like copper and in the air. So it can live for a while on surfaces, but the cleaners will kill it. So keeping the environment clean is really essential. And then kind of the things about your business operations and looking at your functioning and see what's essential, what you can do at a distance, what you can kind of do a little bit differently, but continue to maintain your healthy business was very important. I know that all of you have been working that as well. The last thing I want to end on a little bit is I'm sure you're getting scenarios, and I'll hit on a couple that you may get, and I'm sure we'll get some others in the Q&A, that your employees, I think quite frankly, we know our own employees. This is a scary time. This is an unknown time. People are nervous and worried about COVID and worried about what to do. So you may get questions about employees who have no symptoms, but worried they may have it or be exposed. There is no advising right now that if you have no symptoms, you need to be tested. And really, it's just reassurance to do those preventive things we talked about, hand washing and other things. And if they do develop symptoms, to contact their healthcare provider. I think one thing we have to remember in Nashville right now, it is the start of allergy season. So we're going to have a lot of runny noses, and we're going to have a lot of coughs and those common allergy symptoms. And that does not mean you have COVID-19. And so if your symptoms are typical, and that's most likely your allergies, if there's something unusual, like a new cough that you don't seem to have, then I would get that evaluated. The other thing we've heard too is that an employee or an individual who has been around someone who has been diagnosed with COVID-19. That is something that does come up as well. And the recommendation is for that, if it is truly confirmed COVID-19, then that's something that you would then self-isolate, monitor for symptoms, and the recommendation is for 14 days after exposure. Just kind of keep yourself away from folks. And if any concerns, obviously, there are a lot of venues. And on the next slide, I want to kind of hit, there's a lot of hotlines, and I know that we've heard about some. So I think ours is coming up too, that with their questions, there's the Metro hotline, the state hotlines, the Vanderbilt patient hotline. They can really help guide specific scenarios and questions and direct you to whether it needs to go to an assessment site or other resources. And then I point you out on the bottom of the slide to really very good resources. I think what we've seen now in the age of information, and unfortunately sometimes confusing information, is you don't know really what's true, what's not. So really go to those reliable sites. The CDC site is very clear and has some really good guidance. Almost, you got to find out, kind of figure out where you need to go, but go there. Tennessee Department of Health is an excellent resource. We have a coronavirus website as well, and there are others at other facilities, but just figure out the health authority that you trust and go there for kind of information, especially if you hear some scary things on Twitter or other things. Really look for those reassuring information. So I'll end there, and I'm sure we'll have questions come up when we get to that part of the program.
Thanks so much, Dr. Pinson and Dr. Talbot, for the really useful information here. We are going to pivot over to Lee Harrell, who's the Vice President of Policy of State Policy at the Nashville Chamber. He is going to give us a brief overview of what's happening up in the federal government with the legislation that is being considered today. Lee?
Thanks, Stephanie. I'm actually watching the House as they just passed, just in the last 30 seconds, passed the legislation that the Senate passed out last night, or excuse me, 2 nights ago. So the Senate passed it unanimously. There was some opposition in the House, but nominal number of congressmen opposing. We want to open up by saying, please consider this a general overview of the federal legislation I'm about to discuss. In no way consider this legal or taxation advice. Please consult with your tax and legal professionals on what may be best for you and your business. But do want to give you an update on the legislation. Again, it just passed, and most likely later today will go to President Trump for his signature. First, I know we have 2 professionals with us that will speak later about the current existing Small Business Administration loans. So I'm not going to touch much on those. I'm just going to talk about the new relief that's most likely, again, going to be available in the very near future once Trump signs the legislation. It does, however, provide just a little bit of additional relief through the traditional SBA loans, in that if your business has applied for a Small Business Administration loan, in response to the challenges you face with COVID-19, this new legislation creates emergency grants, which will be available through those other funds, where you can get $10,000 in 3 days or less through the SBA while you're waiting for your application to be processed. So that will be an immediate, near immediate relief provided through this legislation, through those already in existence SBA loans. The new relief primarily that most of your businesses may seek is through what they're now calling the Paycheck Protection Program loans. These will be available to all businesses with less than 500 employees and your 501c3 nonprofits. These will be for the purposes of rent payments, payroll costs, the interest on mortgage payments, cost of utilities, and the interest on debt obligations. Before this webinar, I was an attendee on another webinar hosted by CPAs who very appropriately so pointed out that when it comes to mortgage payments or indebtedness, only the interest on those obligations will be authorized for payment through these loans, which is a very big difference from just mortgage payments or indebtedness payments. These loans will be good for up to $10 million, which is $8 million more than your traditional SBA loan. And the significant factor here that I'm sure you all and your businesses will be most interested in is for those costs associated with the loan for payroll costs, interest on mortgage payments, rent payments, and utility payments. 100% of those costs for the loan will be forgiven. So the vast majority of these loans are anticipated to be forgiven, again, assuming they're going to primarily payroll, but these other costs as well. For those small percentage of your loan amount that does not go for these purposes, there is a cap of 4% interest and a cap of 10 years for maturity for those loans. So for the most likely maybe 5 or 10% of the loan you take out and do not use for those identified purposes, and for those amounts that are not forgiven completely, you're looking at up to 10 years to pay those off and a capped interest rate of 4%. And again, I know this is very quick and an overview. We'll provide a lot more information once Trump has signed this into law. We have a lot more resources available. But what I want you to take away from this overview more than anything is that if you receive a traditional Small Business Administration loan for COVID-19 purposes, you are ineligible for the benefits of what they're, again, calling the Paycheck Protection Program. So get with your CPA, get with your HR folks, get with your attorney to decide which option is best for you. Again, that loan forgiveness piece is very, very tempting, very, very enticing, but you can only do one or the other. You can't do both. So again, I encourage you to know your options, to get with the right folks, to look at the details, and to make the decisions that's right for your business. And with that, I will turn it back over to Stephanie.
Thanks so much, Lee. Appreciate the update. We are now going to go to LaTanya Channel with the SBA here locally.
Good afternoon, everyone. Thanks so much for the Chamber for hosting this event and the partnership with the other organizations that are participating and planning and getting this information out. I see already from looking at the chat, there's some questions that have come up about SBA assistance. So I'm going to spend a little bit of time to go over in general what's available from the SBA in times of what SBA is considering for SBA purposes a disaster as it relates to COVID-19. In general, SBA has a particular loan program, and yes, it is a loan as it concerns the Small Business Administration, whenever there is a declaration of a disaster. And as many of you on the line have probably heard, as of last Saturday, there is essentially has been a nationwide declaration of a disaster concerning COVID-19. Tennessee actually received its declaration after the governor submitted it on late last Friday. Here's what that means. I don't know if many of you were on the call we did yesterday as it relates to the disaster for the tornado, but I want to leave you today understanding the difference. So I'm only going to focus on what's available on COVID-19 as it relates to COVID-19 from the Small Business Administration. My information is here, and we'll make sure you get it in the chat as well. So if you have any questions that are related to the tornado declaration, contact our office and we'll make sure we get those answers directly to you. And if you happen to be a business that experienced the double whammy, affected by the tornado disaster as well as COVID-19, some of your questions will probably be answered in the few minutes that I'll talk to you right now. So here's the bottom line as it concerns the Small Business Administration. We are a federal agency, and normally when you hear of Small Business Administration loans, those loans are provided by a bank. Your typical bank, you probably have a relationship with the banker, or you may sometimes see signage or stickers in windows that says we are an SBA lender. Those funds and processes and decisions are all made by that local lender. There's about 90 plus of them around the state of Tennessee. But whenever there is a national declaration of a disaster, all of a sudden SBA's department, which is a separate disaster department, kicks in and provides the loans directly from the government. And I know many folks are like, a loan, I don't need a loan right now. I need additional assistance. Oh, it's big government, and oh my God, this will never happen. Trust me, yes, it's big government. Yes, it may take a minute to get those loan funds. Yes, it may be a stressful process to get it, but here's what you need to know. The money is there. The money is available, just specifically for businesses who are seeking these loans as it relates to COVID-19. So as you see on the screen, just also to be very, very clear, as it concerns this COVID-19 declaration, the only businesses that are eligible are small businesses, which is very different than under the tornado declaration. So for COVID-19, for Small Business Administration's direct government loans, only small businesses are eligible. If you're not sure whether or not you meet the criteria of a small business, reach out to my office directly and we will show you how to figure that out. Many people assume that small businesses are topped out at 10 or 20, but depending on what your industry is, the number of employees can go up to 500 and still be considered small. And sometimes based on industry to determine if you're considered small, we only look at your receipts. So it's based on industry, and we can help you figure out, if you don't already know, whether or not you qualify as a small business for this type of direct loan to help with the COVID-19. The amount of the loans can go up to $2 million at an interest rate of 3.75%, and the terms can go up to 30 years. You also see a note here on the slide that nonprofits are eligible for these types of loans. If you're trying to figure out if you're the type of nonprofit that's eligible, please reach out to my office and we'll walk you through, because we can let you know whether or not you're eligible before you go ahead and attempt to apply as a nonprofit. We've also received some questions as to whether or not faith-based organizations or churches are eligible under these economic injuries disaster loans. There is a way that certain components of a church are eligible. The quick and dirty of it is if there's a separate legal entity, then it may be eligible, but I encourage you to reach out to my office directly and we'll help you figure that out before you even attempt to apply. So I want to make sure you're also clear that the purpose of these, what we call economic injury disaster loans, and you know in federal government, we like to use acronyms. So if you ever hear anyone, usually it'll be us, a government employee, saying an EIDL loan, that's what we mean. It's EIDL, Economic Injury Disaster Loan. It's the purpose of the loan is to get you over, to tide you over, to help meet those ordinary and normal expenses that you have that continue to come up, that you continue have to pay while you're getting through this disaster and your revenues have been reduced or simply gone. So we're talking about accounts payable, we're talking about payroll, we're talking about rent. Here's what you need to know that is so super critical as it concerns just these COVID-19 SBA direct loans. And this decision was made just this past week. And so for any of those loans, once you apply, and if you are approved for a COVID-19 economic injury disaster loan here in Tennessee, and actually nationwide as well, you have 1 year of a deferred payment from the execution of that promissory note. That's an entire year before you have to start the payments back after the execution of that promissory note. As we all know, we are in very, very uncertain times as it concerns COVID-19. So again, 1 year from the execution of that promissory note to get you through. And then from there, you'll talk to the SBA about getting those disbursements to you. Again, this is a direct government loan, so there is no application fee, there are no points, there are no closing costs. Currently, as it stands today, if the loan is $25,000 or less, there's absolutely no need for collateral as well. Just to let you know, over the last week or so, not only has our office here locally, my office is actually here in Nashville. I'm sitting in Nashville right now. My team has received tons of information, tons of inquiries and requests as it concerns the stimulation bill, the economic package that Lee just mentioned that was just passed in the House. There are going to be some provisions in that package to address businesses that are affected by COVID-19. We do not know what those are yet until the president signs them. As you know, when law gets passed, things get changed throughout the entire chain of the process. So as soon as we have that information, we'll make sure that everyone gets that and how it's going to help benefit any firms that apply for this type of loan going forward. Next slide, please. And again, this is a quick and dirty. For those of you who were impacted by the tornadoes that started in Nashville and ended all the way up over in Putnam County, there is a separate declaration for that. And in that particular declaration, there are physical disaster loans and also economic injury disaster loans. But I just want to leave one message to you for the purpose of this call. As we talk about COVID-19 and small businesses, the only type of SBA assistance right now is economic injury disaster loans for small businesses and nonprofits. You can go to the next slide. And finally, I'm putting up here the phone number for our SBA disaster office. Let me just let you know real quick, as I mentioned to you, I am in Nashville right now. My staff works out of Nashville. We cover the entire state of Tennessee. I have a staff of 10. Whenever there is a declaration of a disaster in a local area, and usually those are national presidential declarations after the governor submits the request, what happens is our SBA disaster office is an entirely separate department, separately funded, separately managed, takes over and assists the local office in making sure the public is aware of what's available to them and also with that process. Here's what that looks like for us here in Tennessee. I got some good news and I got a little bit of bad news. So what that means is there's an 1-800 number that you're seeing on the screen. That is the phone number to our Atlanta office, which is where our disaster office is headquartered. There's also an email listed on the screen. That is the email to our disaster office that's headquartered in Atlanta on the screen. What you don't see is the link to apply for the COVID-19 application. I'm sad to let you know right now the system is down. As you can imagine, as of Saturday, the entire country is now eligible. All small businesses in the entire United States are eligible for these COVID-19 economic injury disaster loans from SBA. Here's the challenge that we had, particularly here in Nashville. The first challenge that we had is that we had already had centers, physical centers set up with individuals, SBA staff here on the ground between Nashville and Putnam County to help you with that application process. As of Sunday, and now those centers have been open over the last few weeks since the tornado. As of Sunday, those centers are now closed because of COVID-19 concerns, and we didn't want to make anyone get ill, whether it's you, the public coming in, the small businesses, those employees there. So at this point, every single thing is online and virtual as opposed in order to apply for one of those loans. Here's the good news, kind of, sort of. I do have 10 staff here in Tennessee. So for the last few weeks since the tornado hit, and for the last couple of weeks since the increase in COVID-19 cases, my staff is no longer doing normal operations. We are only assisting the public as it concerns these disaster applications, whether it's for last disaster loan applications, whether it's related to the tornado disaster or the COVID-19. What that means for you is call my office, 615-736-5881. Every single one of my staff members can answer that call and get the questions to you. If you call and it goes to voicemail, that simply means that all 10 people are on the phone, including me. I'm taking calls as well. You can also email my office. I'm sorry, I did not put the email on the slide, but the email is simply tn@sba.gov, But I'll be honest with you, call, you can get your answers answered quickly on how to get through, you get your application submitted for these economic injury disaster loans. Again, we're handling the overflow from the 800 number that you see on the screen. And we're also taking questions to help people understand how the heck do I apply online for a disaster loan when the system is currently not working. We have those steps for you, which is simply, we're going to show you what those forms are. We're going to send you an email for the paper forms and give you the link so you can upload those documents once our system comes back online. And again, so I apologize on behalf of the SBA. Please know our SBA disaster department that I mentioned ramps up in times of a disaster. The current struggle we're having right now, we're in the process of hiring 500, literally 500 people around the country on top of the several hundred people we already had working because of the tornado declaration and other disasters that are ongoing. But it's very difficult to get those people in the room to get them trained and ramped up. So trust me, SBA is working on it. We're going to get this information out to you locally as much as we can. Again, my name is LaTanya. I'm the state director here in Tennessee. I'm a Nashville native. I'm a Nashville resident. I'm not a Nashville native. So I'm here for you and working closely with the Nashville Chamber, with the Nashville Entrepreneur Center, and with the mayor's office. And there's even more information coming out soon on how we're going to assist you, to include, starting next week, we're going to do twice-a-day calls from my office. So we'll get that information out to everyone who registered through the chamber. And thank you so much for joining, and thanks for hosting.
Thanks so much, LaTanya. Appreciate your time today. We are now going to go to Brian HASSETT, who leads up United Way here in town, and he's going to talk a little bit about the Nashville Response Fund. Brian?
Good afternoon, everyone, and thank you, Ralph and Stephanie and Dawn, for including us in this presentation to the community. A little over about 2 weeks ago, Mayor Cooper asked the United Way to manage and deploy charitable giving to the community through the Nashville Response Fund. We are working closely with the Community Foundation on tornado relief as well, which is their principal focus. Ours is on the economic disruption to employees in the community, and doing our best to try to help them with their needs. Senator Bill Frist has agreed to chair the committee. They've met twice. We've distributed $300,000 initially to a handful of organizations that you see on the screen there. These are all organizations that we know well and that also have trained social workers and are capable of dealing with immediate cash assistance. So Conexión, NeedLink, Salvation Army, Catholic Charities, Martha O'Brien, and Rooftop. Salvation Army and Catholic Charities are open to all of Middle Tennessee right now. We are working to identify other organizations in the surrounding counties to work through as well. We've had some significant contributions. Butch Spiriton and the Nashville Convention and Visitors Corp contributed $500,000. The Music City Center and Charles Starks contributed $500,000, and the Frist Family Foundation has contributed $1 million. We are trying to deploy those funds immediately to these organizations, this initial group of organizations. And I will tell you that the NashvilleResponseFund.com has everything that your employees would need in terms of resources to connect to these organizations, either by phone, online, or if they need to walk up, they can walk up. We are hopeful of helping as many people as possible. $2.3 million currently. Some of the funds will be deployed to help stabilize the nonprofits who are struggling as their fundraising has declined or they've had to cancel events, runs, galas, etc. We're aware of a couple of organizations that are really struggling as charitable contributions have been diverted to these two major disasters. People that want to get help, they can call 211. 211 is the 911 of non-emergencies, although in this case it is an emergency. 211 can direct individuals directly to the organizations I've mentioned earlier and others. There are resources on our website for individuals for organizations seeking to be funded. And also we have direct links for small businesses to many of the things we just heard about from SBA, the Congressman Jim Cooper's office, and others. I will, we're trying to help as many people as possible. We are grateful to Nashville, Tennessee store for creating a t-shirt that's for sale today. And a lot of people are pulling together to make this happen. It's a very generous community. We're going to do the best we can. Visit the website, NashvilleResponseFund.com, and everything you need for your employees to get help immediately is there. And we're grateful for any financial support that might come as well. And I do want to thank the Chamber again. We're members of the Chamber. We get a lot out of our relationship with the Chamber and the business community. Thank you.
Thanks so much, Brian. Really appreciate the information about the Response Fund. It's great to know that resource is out there. We are now going to hear from Rob Mortensen, who heads up Hospitality Tennessee, who will tell us a little bit about what's going on in the hospitality industry. Rob?
Thanks, Stephanie. Yeah, I'm kind of where we are, where we were, and where we are, and kind of where we're headed. So, as some of you all know, and hospitality and tourism is kind of the face of Nashville. When people come to town, they go to our restaurants, hotels, and to our attractions. We were setting ourselves up this year to be one of the best years that we've ever had. Record-breaking year, not only for revenue, but we've got more hotels in our pipeline than any city in the nation. And all of that kind of came to a stop about a week and a half ago. So restaurants were hit probably the hardest. They were kind of on the front side of this. We are now seeing hotels and obviously attractions as well as people are staying home. We're down, I would say, about 80%. And it depends on where you are. Obviously, in the downtown areas of Nashville, we're seeing more of a downturn than we are in some of the outside cities. But so what we're doing, and we're as you all know, and if you've met anybody that runs a restaurant or a hotel or attractions, they're pretty tough folks, and we're not sitting around waiting for this to take us down. So one of the things that I am asking restaurants is that if you can do curbside, if you can do delivery, or you can do pickup for folks, please do. It is a service to your community, and I'm asking Nashvillians that if you, in the past, have eaten out twice a week, go 4 times. Go pick it up, bring it home to your family. Go eat in those places that you typically go, and it might bring a little bit of normalcy to your life. So we're working with the mayor, the governor, and the feds on getting our folks, relief. As Brian HASSETT just mentioned, our folks are one of the first folks that were hit, and so we are guiding and helping our folks towards the COVID response fund. One of the things that we were working with the governor around is relaxing some of the rules on the sale of drinks. So when you go pick up your food, you can take a drink with you, and that has helped our restaurants immensely. We're also working with the Department of Tourist Development, the Grocers Association, and the Retailers Association. What we realized is that our folks, as they were being laid off, the grocers and the retailers are needing folks. So we've set up an exchange, and you can go to the Department of Labor. There's a link, Tennessee Talent Exchange. And for folks that are currently not working or have been laid off or looking to get laid off, they can find jobs there. So that's been a great asset for our folks. As Lee Harrell mentioned a little bit ago, now that we've got the stimulus package passed, that is going to be a lifeline for our folks as we move through the next couple of weeks, and hopefully not too much longer. One of the interesting things that we've realized about this downturn is that people really, really need the social aspect of restaurants and miss that. And so we're optimistic that when when we're given the green light to go, we'll see a big rebound. Folks will be back in the restaurants and out visiting our attractions across the state and spending the night. And we're looking forward to seeing everybody there. So thanks, Stephanie.
Thanks so much, Rob. And now we're going to hear from John Scannapieco with Baker Donaldson on legal considerations for business.
Okay, thank you, Stephanie, and welcome everyone. I chair the global business team at Baker Donaldson. My contact information is there. If you need it, we can move to the next slide, please. We have been working on COVID-19 since probably early January, when it first really rose in China and was impacting our business clients there. And we literally have followed it around the world, addressing issues as they come. I have on the slide, probably until yesterday, the three most common areas that we have been trying to address. But that has really all changed since Wednesday night with the Senate version of the stimulus bill. We've been parsing through that and already starting to help our business clients navigate those issues. Obviously, the economic injury disaster loans and the Paycheck Protection Program loans, which you've already heard about, these are already becoming very important. And then we're working with large businesses that maybe don't qualify for those programs to see what in that stimulus package they can take advantage of and how it can benefit their business. From the employment perspective, I'll only touch on one item as we're short on time. The Families First Coronavirus Response Act will be effective April 1, and this is about the extended leave. So the first component is paid FMLA leave for the employees who cannot work or telework because of school closures and daycare closures. That will provide 10 weeks of paid leave at 2/3 rate. And then, of course, the enhanced paid sick leave for a variety of COVID issues, whether you're sick yourself or forced to quarantine, or maybe you're taking care of someone who is ill or is forced to quarantine. If it's you that has the issues, then that's full pay. If you're taking care of someone, that's 2/3 pay. The benefit to employers is that whatever you pay out, there is a full reimbursement by the government through a tax credit. Now, this is only eligible for employers that are 500 employees or less, but in essence, you won't pay back your payroll tax. You won't pay your payroll tax. That's the credit. Now, if for example, you've paid out more than what is available through the payroll tax, then you can submit an application to the government and you will get reimbursed that way. My understanding is right now that those applications will be processed in about 2 weeks. Well, on the cybersecurity, we're seeing an increase in hacking attempts as more and more people are working remote, either because their companies don't have sufficient protocols and firewalls now to deal with all of this work that is being done outside coming in, or we've even seen an increase in employees, say, working at using public Wi-Fi that is unsecured. So that is definitely something that you want to work on your hygiene there and clean that up and make sure that your employees are fully aware of what is available. On the insurance, I'll briefly talk about business interruption. Unfortunately, as of right now anyway, it does not appear that most of these policies will provide coverage. The way they're written, they usually are focused on physical injury or loss to property. And here, we're closing because maybe a government order has told us we have to shelter in place, or just simply because we want to protect our employees. Several states have introduced legislation to maybe require these policies to be paid. We'll see how that goes. And I know 18 members of Congress have written letters to the insurance industry, but I think it's too early to tell on that. But I would definitely would check back. If we can go to the next slide, please. We have a resource hub that we've created that really drills down on a lot of the issues you've heard today. We actually have alerts and other publications that drill down on very specific issues with respect to most of the issues you've heard about. We have links to other resources, so I only have a couple of minutes today, but if you want to check out www.bakerdonaldson.com/coronavirus, literally we have a task force and other resources. Please check that out as well. If we can go to the next slide, please. Now, I serve on the board of the Community Resource Center. I've been involved since probably 1992. Recently has been president for most of the last 15 years. We are part of Metro Nashville's disaster response program. So we get activated in times of crisis or emergency. So for the tornadoes and now for the COVID response, we've been collecting materials for the tornado, and then we distribute them back through our nonprofit agencies to the affected communities. And now we're doing the same with respect to the COVID crisis. If you see on the second bullet, this is what we're looking for. You can donate these to the Community Resource Center, and then we will make sure they get distributed to the healthcare providers who are in need. If you have any supplies to donate, there's the contact information there, the website, the phone number, also email. And then I say we will soon have, we do now have it. It was activated literally about 20 minutes before I got on today. There is a crcnashville.org/COVID page that will give you all sorts of information. So please, if you can, donate, because I think as we heard from some of our speakers today in public health, they're helping with this response. They're in dire need. So thank you very much. And like I said, please reach out to me. I am happy to help you work through some of these issues and help you find, the right programs and benefits that will help your company navigate this trying time. Please stay safe. Thank you very much.
Thanks so much, John. And now we're going to hear from Bill Herbert, who's the director of Nashville Metro Codes. Bill?
Stephanie. Video up. Yeah, so for Metro Codes, here's the takeaway for us. It's business as usual. We have altered our processes to operate as remotely as possible, but every service that we were doing prior to COVID-19, we're still continuing to do. So this department, what we do principally is we issue permits, that's building permits and trade permits. We review plans, we conduct inspections, and those are building inspections and trade inspections like electrical inspections. And we issue final UNO letters so that people can move into their businesses or into their homes. All of those processes are still in place, just as they were. So on our permit side, we're taking permits now by appointment. And you'll see on the slide that there is an email address where you email, request an appointment. A zoning examiner will get back to you, will set the appointment, and it will be done remotely. In terms of our plan reviews, everything is the same. Plans are reviewed remotely and electronically. Our inspections are requested in the same manner. You may call in or email in for your inspection. On the property standards end, and those are inspections for junk, trash, debris, high grass and weeds and the such, please continue to enter those requests for inspection through the mayor's office, through the hub at hubnashville.gov. We also do final UNO letters to get people in their structures. We will take in those letters by email, the request for the letter by email. That's the best way to do it. Or you could submit it by telephone. Stephanie, that's all that I have. The takeaway for codes is we're up for business and business as usual. We're adjusting our processes for social distancing, but business as usual. Thank you.
Thanks so much, Bill. And now we are going to turn it over to Kenyatta Lovett and to Marla Rye. Kenyatta is with the Tennessee Department of Labor and Workforce Development, and Marla is with Workforce Essentials. Kenyatta?
Okay, can you hear me, Stephanie?
Yes, we can hear you now. Thanks, Kenyatta.
Awesome, thank you. And thank you everyone for allowing me to speak to the group. Again, this is Kenyatta Lovett. In addition to me presenting on workforce development, we have Marla Rye, who heads up the Northern Middle Tennessee region's workforce system. This conversation today that we want to have, and we'll be as brief as possible to get to the Q&A section, is really related to COVID-19. What do we do with, or what resources and services are available to employers who are experiencing some workforce challenges, whether that be decreases because of COVID-19, where you're having to reduce your workforce, or increases as it relates to increased demand as a result of COVID-19. And also we want to talk about dislocated workers and what they should do in this situation of impacted by COVID-19. Next slide. Next slide. Next slide. Sorry. Yeah, so one thing to mention is, it's been mentioned before, is that the tornado has had, oh, go back to the previous slide, I'm sorry. The tornado has had some impact on Middle Tennessee in terms of businesses and workers, and it's just good to know that we have deployed and previously deployed our mobile American Job Centers to provide services across the region to make sure individuals could file claims, employers could get services, and more importantly, if there were people that needed to file any other information and lost internet connectivity, our mobile American Job Centers were available to take care of that. It's just good to note, so if there are ever needs from any employers to bring a mobile American Job Center near you to have a little bit more proximity, we have that available to employers and to dislocated workers. Next slide. The Northern Middle Tennessee Workforce Board, led by Marla Rye, is available to support you as an employer or any of the dislocated workers. One thing to mention is there are services for incumbent worker training. So if you are an employer that currently has a need to ramp up your workforce or retrain them given the impacts of COVID-19, please reach out to Marla and her team to talk about what resources, what funding opportunities are available to support that effort. It goes anywhere from supporting sometimes some of the salaries and wages for a period of time to also providing equipment and training tools for those who are trying to get upskilled or either get into the workforce. And then also for the dislocated worker, Marla and her team can provide all the career services and training necessary to make sure that if they've experienced a loss, they can quickly get back into the workforce as soon as possible. And again, there's funding and resources for that. Next slide. At the state, is a couple of things to mention to everyone. First, for the employers, we do have a rapid response team, as does Marla and her team. This rapid response team is available if you feel like or you're ready or prepared to have a major reduction in your workforce. We can come in and provide services, information to help people to know what to do in that unfortunate situation. The other thing I wanted to make notice of is that if you are planning to have a reduction in your workforce, it's important for you to fill out a WARN notice. That WARN notice will trigger a lot of different services to kick in to support both you as an employer and your workers. And also for unemployment insurance claims for employers, if you have multiple dislocated workers that will be impacted by your reduction in workforce, we encourage you to do that in a mass claims process. So you can actually fill out the names of your employees that will be dislocated, submit that to us through the Jobs for TN website, and we can then already begin processing those dislocated workers to make sure that their unemployment insurance claims are quickly handled and processed so they can get immediate service as opposed to them going through the lines and trying to get that provided to them. Lastly, I'll say on the dislocated worker side, because of COVID-19 and social distancing, we've limited access to our American Job Centers across the region and across the state. However, we are providing services virtually and through the phone. And so more and more we're adding resources to make sure we can serve those needs. But if you can go online, and if anyone that you know is a dislocated worker, if they can go online, Jobs for TN is the ideal site to go ahead and handle all of their unemployment insurance claims if they need to. Next slide. And last but not least, and thank you, Rob Mortensen, for highlighting this great program that was announced yesterday during the governor's update to the entire state, and that is the Tennessee Talent Exchange, powered by the Jobs for TN. We are seeing great traction in this space. Again, as Rob Mortensen mentioned, the hospitality community is experiencing a great downturn in workforce demands, and we want to make sure that those dislocated workers get to safety and get into jobs to keep them moving forward in their path in life. And so we're very honored to have grocers, food retailers, and even those in the logistics industry providing us with those jobs that are available so that we can transition those dislocated workers into immediate jobs that are out there. And so encourage any employers that are thinking about letting go any workers in the hospitality industry to go to Jobs for TN and find out more about the Tennessee Talent Exchange. Also, if those that you know need workers right now in the food and food retail industry, please have them also go to it to let us know what jobs are available. Our goal is to make sure that that transaction happens as smoothly as possible to get everyone into safety as best as possible. And with that, I think the slides are down again, but if anyone needs to reach me or needs to reach Marla or wants to learn more about the Tennessee Talent Exchange, please don't hesitate to reach out and call me, and I think the Chamber can send you all of our contact information as soon as possible. Stephanie, I'll hand it back over to you.
Great. And is Marla joining us?
Marla is on the call.
Okay, we'll turn it over to Marla.
Thank you very much. And in essence of time, Kenyatta and I talked, and we decided that we would go ahead and have him cover all the slides. I just want to remind everyone that the American Job Center, as Kenyatta said, has limited services, but we're still there and available to help you. Specifically in Nashville, the number is 615-253-8920. And for those individuals that may have lost their job from COVID-19, there is a tremendous amount of resources available there to help you if you want to go back to school, upgrade your skill sets, free job training, support services to include daycare and transportation services that you might need. So call your American Job Center if you are interested in these services. Thank you very much.
Thanks so much, Marla. And that concludes the presenter portion. We are going to turn it back over to Chamber CEO Ralph Schultz to say just a few words before we go into Q&A.
Hi, everybody. We'll be going to Q&A very, very briefly. Just a couple of quick things. Number one, the recovery from this circumstance is going to be driven by you and the Chamber and the other organizations you've seen listed as partners on this webinar are all attuned to be in support of you. So I would encourage you to check our websites frequently, post your questions, call us. We like you, have adjusted our business practices so that we're oriented right now on the immediate needs. We've redeployed our resources to be able to meet immediate needs. Check our websites. We're already conceiving a webinar about the benefits to business from the legislation that's been passed. So I would really encourage you to check our site frequently. Secondly, just keep in mind that there is a history in Nashville of recovery from these kinds of unforeseen circumstances, whether it's a flood, a tornado, a recession. This community recovers quickly, and it recovers quickly because of the adaptation that businesses apply to the circumstances that we're working through. So we have a diverse economy, we have an entrepreneurial and an enterprising business population, and we have a community that wants to help people succeed. So all of those things are going to be really important to us in the coming months, but they are things that we know that we can rely on because we've relied on them in the past and they've delivered. So I'm going to turn it back over to Stephanie for Q&A with one final reminder, and that is check these websites frequently so that we can connect you to the places that will be of the most help to you, and look for webinars that will be bringing you information. And thanks to our all-star presenters, we had great people on this panel and making presentations today because they know how important you are to where this community is going to end up in the end. Thanks.
Thanks, Ralph. And before we go through the questions that were submitted, several of them were related to the federal legislation and getting a little bit of clarification. So we're going to have Lee Harrell just quickly clarify a little bit about that legislation.
All right, thanks, Stephanie. I went through all the comments and I've tried to capture all the questions related to the new federal legislation, the Paycheck Protection Program. Again, it's eligible employers with less than 500 employees and just C3 nonprofits are eligible, but there is also provisions for sole proprietors, self-employed, and independent contractors. They specifically have language in there regarding gig economy workers such as Lyft or Uber drivers. You heard about the SBA program earlier, not in my portion, but the Small Business Administration portion. Those are current loans. Those are currently authorized loans. This is a brand new program that would be another option for employers. Again, it's up to $10 million. The way they calculate your loan amount would be looking at your payroll for the past 12 months. So not your 2019 fiscal year, but the past 12 months. And you get 2.5 times that payroll amount up to $10 million. So that's the cap there. Again, just to clarify, if you have applied or received a Small Business Administration loan to cover payroll, to cover rent, to cover utilities, to cover the items that are included for the Paycheck Protection Program, you would not be eligible for its benefits. It's one or the other for those purposes. If you have an SBA loan for tornado damage or for COVID-19 related challenges not related to payroll, utilities, rent, mortgage, indebtedness, then you are eligible to apply again for the PPP program. Or I guess I said program twice. I know there's a question about if this disqualification for eligibility triggers at application or at receipt of the funds. I don't have the clarity on that. I've heard it said both ways in other webinars, in other meetings. And I know there are probably raised more questions than I provided answers today, but keep in mind, this is technically not a program yet until the Trump administration signs the legislation. So we don't have guidance, websites, forms. The process really hasn't been laid out. That will be on the shoulders of a lot of federal workers over the days and weeks ahead. So stay tuned, stay informed, be patient. If I didn't get to your question that you asked, it's because I really just don't know at this point. But hopefully, if answers weren't provided today, you now know which questions to specifically ask of your CPA and of your tax attorneys. And with that, I'll give it back to Stephanie. Thanks.
Thanks, Lee. And for those who've entered questions, we obviously have too many to get to today, but we are going to compile those and try to provide written answers to you afterward as well. So if we don't get to your question, know that we will be following up. A couple of the questions had to do with flattening the curve and with when employees or family members should be quarantined. And I just wanted to check to see if we still have representation from Vanderbilt Med Center on the call to answer those questions.
We are here.
We're here.
So specifically, I'll give a couple questions. One, flattening the curve is fine for now, but when we lift the restrictions, won't the numbers spike again? So just if you could speak to that, and also if you could speak to if a team member, an employee, has a family member with early symptoms, but it has not been confirmed as positive, should the family member or the employee be quarantined as well? Do you have any opinions on that?
Yeah, I'll take, this is Tom Talbot. I'll take the second one first. So if you have a family member that has concerning symptoms for COVID-19 and is being tested, I think the wise recommendations, particularly because you're in the household together, is that other family member should kind of self-isolate as well until the results of that's known and practice good hygiene. What CDC says, if that person were a confirmed case in the household, is that person would need to self kind of isolate within the house, kind of keep separate. And there's good guidance on the CDC website about how to care in the home for folks that may be suspected or actual COVID-19 to kind of, it's a lot of the hygienic measures. So yeah, I would self-quarantine until you know the results, and or just self-monitor for symptoms as well. And if the symptoms develop, then they need to be evaluated as well. The second one, the flatten the curve question, is a really interesting one. And I think to be determined, we're seeing, we've got several countries ahead of us, several months that did some flattening the curve, like South Korea, Hong Kong, and even China to a degree. They really did lock down. And so one of the things that folks are very interested in over the next few weeks is what will happen in China as they begin to open up more. Will they see a second wave? We don't know a lot at this point about the degree of immunity and herd immunity that we would have in folks that have gotten the infection, how protective that is. So I think it's a little bit of we need to kind of watch and see. There could be another wave. So I think we have to kind of be prepared. We're hoping not. We definitely know that the distancing is going to blunt the acuteness of the curve and spike, and that's what's really going to help us in healthcare when we talk about limited resources and supplies and ability to care. If we can draw this out over time, it will really help us more so than having a surge within a couple of weeks. So that's also a piece of that flattening that curve.
So much. Several of the questions I know Latanya has been answering in the chat, but I just wanted to point out that we had a few questions about whether loans can be forgiven, and if so, does that happen through the SBA or through local banks? And then related to that, if a company has already applied for an SBA loan and gotten approval but has not drawn the funds, are they able to apply also for the Paycheck Protection Program, or do they need to rescind the original SBA application? Latanya?
Hi, can you hear me okay?
Yes.
This is Latanya. I'm hoping you can hear me. So I'm going to start talking because I did unmute myself.
We can hear you loud and clear. All good.
Perfect. Thank you. So the forgivable loan question. Here's the bottom line answer. As of today, SBA does not have any types of forgivable loans. Any type of SBA loan that we provide, whether it's through our normal loan programs or through the disaster loan programs, must be paid back. If there is something in the bill that I'm assuming as of this moment has not been signed by the president, meaning it has not become law, that makes an SBA loan forgivable, I don't know. I'm going to be bluntly honest with you. Here's the longer answer to that question. I used to be at headquarters prior to coming here to Tennessee to work for SBA, so I would be able to tell you instantly what's in that bill. My job here in Tennessee is to be on the ground to assist you. So my day, 24 hours, 7 days a week, is making sure you get the help by Monday, maybe even by tomorrow morning. I will probably have further details from SBA headquarters as to what exactly is in the final bill. If it has been signed by tomorrow, probably will be by the president, and once it becomes law, as it concerns any SBA loans, whether it's these disaster loans or whether it's the our regular SBA loans. And as far as the PPP program, honestly, I know nothing about it at this moment, and it would be horrible for me to even try to answer that second part of the question at this moment. I might know something by Monday. I just don't know.
Thanks, Latanya, and stay on for just a minute because there are additional questions about whether the loans apply for those who are self-employed or sole proprietors.
Yes, it's a business. Yes.
Fantastic. So we also have some questions. This is probably back to the doctors over at Vanderbilt Med Center about things like to-go orders and the safety of taking to-go orders. What precautions should individuals be thinking about for wanting to keep the economy going by supporting small businesses, but also being safe?
So the good news, and I've gotten this question from a lot of friends in my own family as we do a lot of takeout to support local businesses, is that the usual care that you would do in food preparation would kill the virus if folks were working, say, asymptomatic and on their hands and other things. And as well as any concern kind of on packaging. I know some folks, some of the delivery stuff does kind of a distant delivery where you don't really as engage with the delivery driver as well. But in general, that should be safe. The food is warm, it's hot. If your food comes cool, I would warm it just to be safe, just for any kind of food issue. But your usual preparation should be fine. And the good thing is that I strongly endorse that because we want our local businesses to really get through this. So you take out a lot.
Fantastic. And now just to make sure we're covering all topics, we've seen some questions about unemployment, specifically individuals who've maybe lost their job or they've been in an industry where they've had to be on furlough. Could either Marla or Kenyatta, could either of you speak again to what is the best option if someone is looking for employment or looking to supplement the income that they've lost?
Marla, do you want to field that one?
Sure, I'll be glad to. So first thing to do for individuals that have lost their job is make sure that they go on jobsfortn.gov and file an unemployment insurance claim. Um, before you do that, check with your employer and make sure that the employer did not file a mass claim on your behalf. That's what we're encouraging employers to do if they have a mass layoff. It will expedite the process for you to get your payments quicker if they file a mass claim. If they didn't, go online to jobsfortn.gov. Also on that website, you can also find career exploration tools, the talent exchange that Kenyatta mentioned. And also I saw a question about unemployment benefits for self-employed. One of the things that I think you need to do after the CARES Act has been passed, we need to get the details because that may expand unemployment insurance for gig workers and self-employed, but that's not been finalized and I haven't looked at the details yet, but it's something to keep in mind and it was a question that was asked. There's also a question about how many employees before an employer can file a mass claim. Generally, we like to stick to the number 10. And if you've got more than 10 employees, then we encourage that employer to file a mass claim on behalf of those individuals.
So I'm looking at some of the last questions since it is on this topic about benefits that are available to employees who've been temporarily furloughed. Any insights into specifically health benefits?
Is that a question for Marla and I?
Yes.
Stephanie?
Yes.
I don't have any information on health benefits. Marla, any thoughts?
Well, the one thing that I have been looking at for employers that do furloughs or temporary layoffs, I think it's important that the employer looks at their own health care benefits plan and to determine what that plan says as regarding the layoffs. And that's about the best advice that I could give anyone right now is to look at their own plans. There was a topic earlier about supposedly in the CARES Act that unemployment insurance is going to be supplemented by $600 a week in addition to what the state is already paying. But if you lose your health care benefits, that $600 a week is going to be tough to additional $600 to make that payment.
Thanks, Marla. And if you all will stay on for just a second, there's another question about the Tennessee Talent Exchange and whether staffing companies could join the effort to help fill those openings.
Absolutely. I would say reach out to tyra.copus@tn.gov, and that is tyra.cop as in Paul, as @tn.gov. Tyra's leading that effort, and also you can reach out to Rob Mortensen as well for more information on how to connect or how to be a partner in this effort.
Thanks so much. I think we have covered the majority of the broad topics of questions. Again, we are going to go back and look through these questions more closely and make sure all of them are answered in writing. So we'll follow back up with you afterward. We do have a landing page, which is here on the screen, nashvillechamber.com/webinars. And we are going to put the recordings of our webinars on this page, the one today, as well as one for tornado recovery that we did yesterday. In addition to that, we'll have links to resources from the presenters and from other partner organizations. We've had many other organizations who've been a part of this and who have been listening in and providing information as well. And we want to make sure all of that is available to you. We know it can be overwhelming right now taking in so much, but we'll work to make that as easy to navigate for you as possible. So again, you can find that information on nashvillechamber.com/webinars. We will be following up with each of you with that link and the information to get back to the webinar recording. With that, we just want to thank everyone for being here. We are at the end of our time today. We want to thank again our co-hosts, which include the Mayor's Office, the Nashville Entrepreneur Center, SBA, Maury County Chamber and Economic Alliance, the Nashville Healthcare Council, Pathway Women's Business Center, Williamson Inc., and the Dixon County Chamber. We're appreciative of so many organizations coming together. We know that we're all working through this together, and just appreciate everyone taking the time to be with us. So with that, that's the end of our webinar today. Please send us your feedback and send us additional questions if you have them. We're going to give you, for those who are small businesses, we have a team member on staff, Janine Davis. And if you have specific questions related to small business, you can send those to smallbusiness@nashvillechamber.com. Thanks so much, everyone. Have a great day.